Hello and welcome to Healthline 3. I'm Terri Simmons. And today we're talking with Dr. Britton Eaves of Willis Knighton Cardiology about peripheral vascular disease. We'll be taking your calls throughout the show, and as a reminder for you, please make sure you're in a quiet room with your TV turned down low volume when you call in so we can be sure and hear your questions. And the number to call is 318-219-4569, and you'll see it at the bottom of your screen throughout the show. So thank you again for joining us, Dr. Eaves.
Well, thank you very much for having me. I really appreciate it.
Oh, it's wonderful, and it's a wonderful topic, and I'm sure a lot of our viewers are really going to be interested in hearing what you have to say. I've already learned so much just from the couple of previews we've done this morning. So tell us, let's just go ahead and start off with what that is exactly.
Well, peripheral vascular disease really refers to the circulation or the arterial blood supply to everything except the brain and the heart, which I don't myself do any work on the brain, but we do work on the heart as well. But primarily what we're going to talk about today is the circulation to the legs, although occasionally we do have some circulation problems in the arms that we also work on. But I kind of want to focus a little bit on the legs, although certainly if somebody has a question about something with their arms, we can talk about that as well.
Okay, great. And so who is at risk for this condition?
Well, just about everybody has a certain amount of risk, I suppose. Some of it is lifestyle. Anyone who smokes, that's probably one of our biggest modifiable risk factors. Anyone that has elevated cholesterol, and folks with diabetes. So those are our number one patient population that we would look into. But also sometimes people just have a tendency, it's probably genetic, to lay down calcium in their arteries. The old folks used to call it hardening of the arteries. But primarily what we're talking about is the deposition of cholesterol inside the artery, which causes a narrowing of the artery and causes reduced blood flow to the legs or arms or whatever organ is affected.
Right. And you mentioned diabetes. So sometimes I think when we talk about these different conditions, we forget that you can have more than one layered on conditions. And so you talked about possibly sores on the feet, which might be indicative.
Unfortunately, certainly that's the way we would like to have people be educated so that they can have this problem diagnosed and treated before they get to the point where they have sores on their legs. But just to give you a little bit of background, I've been doing this probably around 15 years plus or minus, and even then we had people come in and would actually have their legs amputated without even being evaluated to see if there was anything that could be done to open up the blood vessels. So we've come a lot in the treatment and management of this disease in the last 10 to 15 years, and really it's multidisciplinary. I work very closely with the podiatrist. A lot of times people come in with foot pain and the podiatrist says, gosh, there's a sore on your toe, or the toe itself looks a little dusky, a little bluish, or something's not right. They feel for the pulses, and actually I get a lot of referrals from the podiatrist, the foot doctors. And so we want to try to find this before there are sores on there, but absolutely if you have sores on your feet that are slow to heal, you should pretty much immediately see your primary care physician to see about getting referred for some of these studies to see what's going on.
Yeah, and so glad you're here today, because that's something that you said, yes, commonly we'll just look at it and think, oh, it's just something else, or it's age, or you just don't think about it. But it is good to ask if there's any other, is that just in general? Just ask your doctor, is there any other condition that might be causing this, rather than go right to thinking it's diabetes or?
Well, in general, if you have a sore that's slow to heal, the number one cause of that is going to be decreased blood flow. Honestly, the whole point of the circulatory system is to deliver the blood supply to the tissue and deliver the oxygen and then the other nutrients and stuff. So if there's a slow healing going on, most likely it's because there's not enough blood flow to allow the proper healing. But we do work in close conjunction with other physicians. We work very closely with the wound care doctors. Sometimes we have to send these patients with the wounds on their feet to the hyperbaric chamber where they get extra. It's a pressurized chamber that allows more oxygen to go into the tissue. But sort of, as the old saying goes, where the rubber meets the road, it's all about perfusion. There really can't be any good healing of those and good reduction in symptoms unless there's proper perfusion.
Right. Tell us a little bit more, since you mentioned the hyperbaric chamber. What is that exactly, and what is that? What happens?
Well, so that is actually it started off as a way for divers to decompress, and also they use it for carbon monoxide poisoning. Basically what it is, it's a pressurized tank that patients can go into, and they change the pressure so that the amount of oxygen that's actually breathed in and out is a much higher level. So it actually sort of drives the oxygen into the tissues.
Wow, that's so interesting. So tell us about, are there specific symptoms that might lead someone to request to be evaluated for this condition?
Well, again, first off, if you have the multiple risk factors, it's something you should be thinking of anyway. The other thing I'd like to mention is just the fact of having peripheral vascular disease is a risk factor for also having cardiovascular disease and also cerebral vascular disease. So there's about if you make a circle with each one of those types of disease, there's going to be at least a 20% overlap. So if all I knew about you was that you had heart disease, there's probably somewhere around a 20% chance that you could have peripheral vascular disease. There's maybe a 20% chance that you could have cerebral vascular disease, such as a blockage in your carotid arteries or something like that. So if you have the risk factors, or you have one of those other diseases, that should be a sort of be in the back of your mind that maybe I should pay attention and maybe have some of these other things evaluated. And again, the symptoms of it sometimes are, people just put it off to, I'm getting older, I can't do what I used to be able to do, I can't walk as far, I can't do as much. But classically, for sure, if you have pain in your legs when you walk and it's relieved with rest, you almost certainly, not always, there are other conditions as well, but you certainly should be evaluated for peripheral vascular disease.
And that's a really good point too, to talk about. Also, just pay attention to your body. Any change is something to ask your doctor about, and not just think, well, I'm just getting older, or just take for granted, because it's not a one size fits all. Age doesn't affect everybody the same way.
That's exactly right.
So there's a change, go see about it and ask questions. And that's a good point too, specifically how it feels. Like when you're walking around, it hurts, but what if you lie down and it's relieved, rather than it hurts all the time? That might be more of a specific circulation.
Yeah. So this disease sometimes can cause people to hurt all of the time. Sometimes people, even laying in the bed, they have to hang their legs off the side of the bed to get relief. I've actually seen people come in with burns on their feet because their circulation was so poor that they put their feet too close to a heat source and actually burn them. Like I said, particularly diabetics sometimes, because of the diabetes, can have nerve damage, and so the sensation in their lower extremities is decreased. So they might not be aware of all the symptoms that they are actually having.
Right.
Again, they just think, well, you know, I just can't get around like I used to.
And they think it's all about diabetes and not something else.
Right.
And we have a caller. Stacy, what is your question for the doctor?
Yes, I was wondering, my dad had this peripheral artery disease, and he said it seemed like a Charlie horse in his leg all the time. And I'm starting to have a Charlie horse in my leg, and I'm wondering if that's something I need to get checked out.
Well, it's certainly something you should bring up and talk to your primary care physician about. Typically, not always, if you're having a Charlie horse that's associated with exercise, that makes it more likely that it's peripheral vascular disease and a circulation problem. We do have a lot of times people at night have cramps in their calves at night, and a lot of times this is maybe due to electrolyte problems, not drinking enough water, and so it's not always a definite sign, particularly if it happens at night. But it's something you should bring up to your doctor. I mean, the good news is there's a pretty easy way to do some screening on it. If you go see your physician and you have those complaints, he can actually get you to take your shoes and socks off and check the pulses in your feet. And that's a very easy, if you have good strong pulses in your feet, it's very unlikely that you have significant peripheral vascular disease. The other thing that we can do in the office that's non-invasive, check your blood pressure in your arm and check your blood pressure in your leg, and we divide the blood pressure in the ankle by the blood pressure in the arm, and we get an index. They should be both the same. So in other words, the circulation in general to your arms, the blood pressure in your arms, should be the same as in the legs. And when it's decreased in the legs, that gives us a pretty strong indication that you have peripheral vascular disease. It's called an AVI. And then from there we would do an ultrasound, which again is a non-invasive test. It's basically the tech takes a probe with a little bit of ultrasound lubrication and just checks the velocities in the blood vessels to the legs. It's non-invasive, and it's very easy to do. So for sure, go talk to your primary care doctor about that.
I've got one more quick question. Is it hereditary?
It does tend to run in families sometimes. The main way that it runs in families, the same way that it runs in families sometimes with coronary disease or blockages in the heart arteries. That's primarily because a lot of times hypercholesterolemia or high cholesterol levels is familial, meaning that there are genes that actually code for how the liver handles cholesterol. So it tends to cluster in families. You know, a lot of times if you have a family member that has high cholesterol, you're more likely, you may well have high cholesterol as well. So certainly through the cholesterol, and then diabetes, of course, as we mentioned before. If you have diabetes and hadn't been checked for that, and you have other family members, that might be something that's going to impact for sure. But the number one thing that you can change is smoking. If you do smoke, you're definitely going to be at increased risk for all of those problems. Coronary disease, peripheral vascular disease, cerebral vascular disease.
Okay. Sorry for coughing during that, Daisy. Were you able to hear everything?
Are you smoking?
No. I promise, doctor, I do not smoke. So thank you. Stacy, thank you for calling. Do you have any more questions?
Pardon?
Oh, okay, we have another caller. What is your question? Hello?
I have pretty much all the symptoms that you're talking about. Been through a heart cath recently, all that kind of stuff. I'm just a fat old man, 71 years old. What's the cure? Lose some weight?
Well, the first thing you do if you have the symptoms is to go talk to your doctor and see about getting an ABI and probably a ultrasound of your lower extremities just to see if you have some blockages. That's the number one thing you can do. The good news is if you have any, everything that you're doing to try to modify your risk factors for coronary disease are also impacting peripheral vascular disease. There's a high overlap in the way that we treat the two diseases as far as managing your cholesterol, managing diabetes if you have it, managing high blood pressure if you have it, and then of course avoiding fatty foods, avoiding cigarette smoking. But if you have the symptoms, you know, it's really, when it boils down to it, it's a mechanical problem. And what I mean by that is there's an obstruction that has to be decreased or removed. And we have multiple tools in the toolbox. We have all kind of fun toys to play with. We have lasers, we have other atherectomy devices, we have balloons, we have stents, we have devices that actually can extract if there's clot there, that can extract the thrombus. So we have a lot of things that we can use to treat the disease, but it basically boils down to it's an actual physical obstruction, if that's the problem, that has to be relieved.
Okay, Ron, did that answer your question? I guess you did. I guess you got it. All right. Thank you so much. And talking about different ways to treat, so was there a more common, is it just very individual to each person how it's treated, or do you find a more common treatment?
Well, I mean, you know, the ultimate treatment, of course, is the best way that we can remove the blockage and restore blood flow that goes from the heart all the way down to the great toes. Believe it or not, sometimes we have wires down actually in the toes. Goodness. All the way down there, and sometimes we actually have to access the circulation from the foot because there's so much blockage in between. But the goal is to restore flow, straight line flow from the heart all the way down to the toes. And so whatever type of device we have to use to do that is what we use. But fortunately, we have a lot of tools that we can select from, and it really is kind of an independent patient type of situation. In other words, the laser, for example, we would use that on more of a fatty type plaque, whereas the some other devices that we use, we'd use where there's calcium. We actually have balloons now that do lithotripsy. It's sort of like what they use to treat kidney stones. So it's an ever-expanding, ever-evolving field. We got lots of toys to play with.
That's fascinating to have so many options to help people. Okay, and I think we have Johnson on the line. What is your question?
Yeah, numbness in the leg. Numbness in your legs.
Numbness in the legs?
So, again, if you have numbness in the legs, are you diabetic?
No.
Okay. So numbness in the legs in a non-diabetic, it could be that you have a back problem, you could have a nerve problem, but sometimes if there's significant decrease in blood flow, that can damage the nerves. So, I mean, again, an easy way to do it would be to go see your doctor, have somebody evaluate the pulses in your feet, and that would give you a pretty good indication. If they have difficulty feeling your pulses, then I would say that the next step is to get an ABI with an ultrasound and go from there. But I think it's something you should look into. It kind of brings me a segue. You know, I mentioned podiatrist earlier. So that's where folks get in trouble a lot of times when they have numbness in their legs and their feet. Sometimes if they don't have shoes that fit properly, whereas you and I would feel a blister forming. Sometimes your foot is numb, you don't know that. Sometimes I've had patients that have had a rock or something in their shoe and it caused a wound. It requires a lot more blood flow to heal a wound than it does to actually keep the skin intact. So the issue a lot of times is when a wound is formed and is slow to heal, we've really moved on to a more critical, urgent type of situation.
Right.
So I would encourage you, anybody out there that's listening that has numbness in their feet, to really get in the habit of inspecting their feet. Keep them clean, keep them dry, and really look at their foot to make sure that there's not an abrasion or sore or wound that's forming. Because we actually have people, you know, they don't, I mean, a lot of us, you know, we just take our shoes and socks on, take a bath and shower and go to bed. And, you know,
really
if your foot's numb, you wouldn't
feet.
even know it was there.
Right.
And so people can get into trouble with that. But for sure, don't just have numbness in your feet and just say, well, my feet are numb. Just at least have somebody evaluate and try to find out what the cause of that is.
Go find out. Great question.
Sure.
Thank you so much, Johnson. And now I believe we have Washington on the line. What is your question for the doctor? Washington?
I have my feet have sometimes numbness in them, but it seems like instead of my nails, my toenails growing out where you can cut them off and clip them off, seems like sometimes they be going, instead of going out, they be drawing off into my toe, and I have to dig up in there and try to dig out from up under it to make it start coming back straight out, but it looks like it just gets almost dead skin on the very end of my toe. I got to either take a nail clip and clip off part of the dead part.
I think if you're having that much trouble, we probably should go see a podiatrist, because we do see people get into trouble the exact scenario that you're talking about, trying to manage their toenails at home when they get ingrown like that. Sometimes the toenail itself can kind of grow off to the side and actually make an abrasion on one of the other toes. And then again, as you say, trying to dig out of those cuticles, sometimes you can cause a wound just trying to do that. So if you're having that much trouble, and we're fortunate, we've got a number of really good podiatrists in the area, and so if you have any you're having problems like that, I would really recommend that you find a podiatrist and go have them evaluate that for you.
Does that help, Washington?
Well, pardon me?
Yeah, did that help answer your question? You can call
So foot doctor.
Yeah, just call a foot
Just look up
doctor.
foot doctor. We have, like I say, a number of them. Just look up the podiatrist is what they're called, but I'm sure a lot of them have listings, the foot clinic and that kind of thing. And also your primary care physician could refer you to a podiatrist as well.
Okay, so did that help, Washington?
Okay.
Yeah, just go to your regular doctor or
Yeah.
call a foot doctor.
Thank you so much. I
Oh, thank
appreciate
you. Thank you for calling in.
it. Bye-bye.
Bye-bye. So, Dr. Eaves, what else should we know about this condition as far as ourselves and our family? What kind of information should we really pay attention to?
Well, again, like it's, if you have multiple risk factors or you have a family member, it's certainly something that you should be aware of. And sometimes it presents with coldness. Sometimes there's discoloration of the feet. Sometimes those can be clues. Sometimes in men, the hair doesn't grow quite as much on the lower extremity because of perfusion. Certainly, just like we talked about before, whether you have peripheral vascular disease or not, sometimes I have seen people cause some problems when they have the ingrown toenails and so forth. So, and then if you have peripheral vascular disease, again, can't really emphasize enough that you really need to inspect your feet, make sure you have good footwear. Also, since you brought it up, I'd like to mention too, we also treat venous disease, and I don't know if one of the other physicians may later on talk about that as well, but I want to mention it. So we have a vein center at Willis-Knighton, and what we'll see anybody with any kind of venous problem, but I do want to mention people that get blood clots in their legs. Sometimes, again, in the past, those patients just got anticoagulation and they were sent home and then followed up, and they said, well, take your anticoagulation and we hope that this blood clot dissolves. And that really was the standard of care. Unfortunately, if the blood clot is above the knee, about almost 50% of those people will have chronic condition called post-phlebitic syndrome, and we actually can go in there and we can do a thrombectomy and extract the clot. It's non-surgical. It's through the veins themselves, and sometimes these conditions are caused by compression of the big vein by the artery, the iliac artery. And if that's the case, we can actually go in there and ultrasound and put a stent in there and relieve that obstruction. So that's another service that we offer, and something I think is really becoming more and more into sort of the in other words, more and more people are learning about it, physicians included, because in the past we just didn't, all we did was put those people on anticoagulation.
Okay.
So that's another thing to think about.
Okay. We have Dorothy next with a question. Dorothy, what's your question?
I was wondering if compression hose would help in any way.
So compression hose is great. That almost sounded like you teed me up on that, because that's a great segue
Thank you, Dorothy.
from talking about venous disease. So certainly people who have venous disease, such as varicose veins or what we call venous insufficiency, which is a disease where the valves of the great veins over time become incompetent and the blood and fluid tends to pool in the lower legs. So compression hose is kind of the mainstay therapy, the first thing we do to try to alleviate that. The flip side of that is if you have arterial insufficiency, meaning that you have poor blood flow, not poor venous return, but poor blood flow, compression hose actually has the potential to make that worse. Yeah. And you might say, well, gosh, I'm not a doctor, how do I know the difference? In general, if your legs are swollen, warm, and red, you more likely have venous issues. Now, you can have both at the same time, but that's more likely a venous problem. If your legs feel cool and you have some of the other symptoms with the heaviness and the cramping and the fatigue and decreased pulses in your feet, that's more likely an arterial problem. So again, if you're saying my legs hurt and they're swollen and sometimes they get a little red and I can see I have some particularly if you see varicose veins in there, those would be the ones that you want to put compression hose on. But again, ask your doctor, have them look at it. And we're glad to see all of those. We treat venous and arterial problems as well. So any of those, we're always glad to help and make the diagnosis.
Okay. Okay, and we have the option to put up your phone number. So if you are
Sure.
calling and you can't get through today to talk to Dr. Eaves, we'll have the information right there at the bottom of the screen. So please contact Willis-Knighton Cardiology and Dr. Eaves directly after the broadcast. And I think we do have time for another caller, do we? Margaret? Hi, Margaret. What is your question? Margaret? Okay. All right. So we couldn't hear her very well. So, is there anything else that you'd like to leave us with today? We have a few more minutes while we're waiting on some callers. What would you like for our viewers to take away from this today?
Well, I mean, this has really been our passion, or been my passion, for about, like I say, about 15 years. It's just extremely gratifying. Sometimes we have people come in, they have heart issues. We do a stress test on them. We find a blockage. We fix the blockage. And you see them back in clinic and you say, how you feel? Well, I feel great. You know, I was feeling okay before. I'm glad you found the blockage. I'm doing fine. But I can promise you, if you have somebody that when they walk to their mailbox every day, they have to stop because their legs hurt so bad, and you fix that for them, particularly if you have somebody come in with wounds and they've been told that they have to have an amputation, and you prevent that. I mean, I'm fortunate that I have an occupation that I get that kind of gratification. And I like to say, I'm certainly not the only one doing this kind of work.
Right.
I have many colleagues that are in this area that are all doing great work. But I will say personally for myself, it's extremely gratifying. It's you really, impact somebody's life. You change somebody's life. I mean, if every time they're getting up and trying to do something, because it changes, older people with their grandkids, trying to go somewhere with them, and they can't walk. They have to stop, or, if they think they're going to lose their leg, and it's just it's a great feeling. It's a really great feeling.
I can tell, and it's such a wonderful thread through all of Willis-Knighton every time we have someone on here, and especially talking to you today, all the stuff that we found out that you can do, and one thing leads to another, all of the venous discussions and all of these conditions that lead to that you've just opened up everything for us today. I appreciate so much. Don't just think it's just one condition. It might be something else, and like you said, giving someone their life back or saving something because they asked that one extra question.
We're just really fortunate. Like I said, I'm one of many that are doing this kind of work, and the system has supported us very well and given us the opportunity to have access to all these different devices that we're able to use to diagnose and treat. So the whole community is fortunate for that.
Yes, we are. We certainly are. And I thank you so much for really just going into such detail and certainly answering all my questions. I'm fascinated. I love learning so much with this, and I hope you'll come back and tell us more. You were telling me how busy your schedule is, and we appreciate you being here today. I know that you handled a lot this morning. You came here, and you've got more cases to go take care of this afternoon, so we really appreciate it.
I got a couple, so.
Yeah. Okay. Well, thanks again.
Thank you very much. I appreciate you having me.
Of course. And there, visit wkcardiology.com is there on the screen. So if anybody has any questions afterwards, and you can also always watch the recording of this on our webpage. Just go to the Healthline 3 page on ktbs.com, and you can watch this again and again. And we thank you again so much for being with us.
Thank you for having me. I appreciate it.
All right. You enjoy the rest of your day.
You as well.
And everyone else, thank you for joining us for Healthline 3 today. Enjoy your day, and you take care. We'll see you next time.